Hello. So you know who I am. You see me here before. Well, I'm coming to talk to you today because I have a lot on my mind. And a lot of the stuff that I got in my mind is um has to do with this pandemic and the deaths that are taking place in all the hospitals. You know, I don't know if I'm struggling with it because I wish I could do something about it or because I wish I had the answer. I don't know. I'm not for sure. But truthfully, we need the answer. Okay, let me explain where I'm coming from. This is where I'm coming from. I'm a CNA that works in the COVID unit. And since the COVID started about 9 months ago, I have seen people die back and forth, go cold blue, rapid response, you know, within the hospital. How has that affect me? Tremendously, tremendously, because, um, you know, aside from seeing people getting it, aside from working in the environment, aside from seeing people dying, aside from seeing people walking into it, and aside from being a recipient of COVID myself, not once but twice, it's it's a crazy dynamic to me because um, I'm a CNA who leaves, who wakes up every morning, goes to work, and come home. But prior to coming home, guess what I do? To distress myself, um, I like to go to the store and go shopping so that I can come home with a clean mind from all that I have seen through the day. I work 12-hour shifts and wearing those masks all day long and walking into a plastic uh, r- room that is wrapped in plastic and red tape has been like the trauma that has affected me mentally. Um, so if I go into the stores and go shopping, it kind of usa me, kind of cleans me up a little bit. I spend a lot of money because I spend money because I don't spend my bills money, but I spend like I'll spend like $20, $30 here or there just so that I think I'm feeling good, but I don't feel good. So I stopped going to the stores. But that's besides the point. Um, the reason why I'm talking to you guys is because this is my issue. Uh, as a CNA, as a nurse, we wake up every morning, go into work to help these patients, right? And because we go into work to help these patients, what makes me different than their family members that need to give them the support to help them get better? Um, Even a phone call or a or or a visit is okay. But but what makes me more frustrated now is that a lot of the families, a lot of the patients that we have are dying by themselves. And they don't have they're when they dying, they don't get to say their last goodbyes to their family members, you know? They don't get to ask their last the family member anything. They don't need to communicate with nobody, because aside from me being there, or me being within the room, or the rapid response, or the cold blue being called because it's happening. It would be nice if people have the human touch from other humans, because honestly, at this point, I live by myself. Both of my kids live in different states, and I've been affected by the COVID, and it has been the loneliest thing that I've ever experienced. And like, I don't get the phone calls, I don't get the conversations. All I do is talk to the walls sometimes. Like that's bothering some, because I don't understand what makes me so different from the patients that I go visit. If that's the case, if I'm the person that is going there, that is going to the hospital to check on these patients, to take care of these patients, what makes me so different than the family member that needs to come and give them support and visit their family members? This pandemic has not only destroyed the lives of so many people, but it has also destroyed the mental health of so many people, has destroyed the humanity involvement that we all desire and that we all need from one another to be able to keep on moving forward. I mean, honestly, with this incoming president that's coming in January, I know that his priority is for us to keep our masks on and stay in the homes, and and not to go out and things like that. But in reality, truly, he needs to do more than that, because he's just, this past president has has literally destroyed many of us, many of us poor people that I'm grateful that I have a job, but to not have human connection it's becoming overwhelming every day, every day, and like I see it how it's affecting us. We don't, I mean, we don't communicate with each other. We don't talk to each other. We don't smile anymore. It's like we all angry, and you know why we're angry? We're angry because we don't have the rebuttal that we need. Anyways, I'm rambling, so, and I probably, because I'm stressed. I didn't think I was, but I am stressed, and I'm trying to deal with it, trying to figure it out. I've been on lockdown for the past 4 days um because I was told that I have COVID, but you know what's so weird? Okay, so I was at work having chest pains, and I was I I went to the ER, but that that diagnosed me there, so it took me there, and then because I couldn't breathe, I couldn't, I had to get out of there because I couldn't breathe. So finally, I ended up going to urgent care. But you know what's so crazy? You know what's so crazy? I was diagnosed with COVID through the phone. I was diagnosed through COVID through a computer by a doctor, and then I was told to take some medication because I had COVID. That's what I was told, right? But never did I actually go see the doctor, because when the doctor when I signed in outside, and then after I signed in outside, I was I was um sent a text so the doctor can talk to me through the phone as she diagnosed me of having COVID because I couldn't breathe. I was having a runny nose, um, and I was having chest pain. That's when I was diagnosed with COVID, and which has kept me inside the house for about 5 days now. But I'm tripping out because how am I diagnosed with COVID when I never actually saw the doctor? All I did is speak to the doctor through the phone and told her what I was feeling. Um, I did go get tested, but I never got my results until I haven't got received my results as of yet. As of yet, I haven't received my results. But I was diagnosed with COVID before. So my question is, I'm not saying that this is not real because it is a real virus. It is a real virus because I see the people dying. My question is how do we change it where families, where individuals who are sick with COVID are not dying by themselves, they are not dying without their families. You know what I mean? Like even my worst enemy will probably have somebody there.